Welcome to the mobile technology presentation for the mobile app Medication Manager. My name is David Din, and I'm here to present this product for the Heiser Health Apps Challenge 2013. I am a passionate product lead for mobile technology, and my daily role revolves working with software for the healthcare industry. This product idea came about through a personal real-life experience recently. At the age of 70, my father is a very busy man. It is not from work but through his active retirement lifestyle. He goes out a lot, visits friends every week, and has an active physical exercise regime. However, on a daily basis, he has to take several medications for his chronic illnesses and ongoing health issues. On several occasions, when he feels very healthy from the exercise, he intentionally skips his meds. Many times he just forgets. Since he's taking 5 different types of medications daily, even the family members are unsure what he should have during meals. Since my father is a smartphone user, this led me to investigate mobile apps that could help him remind and take the right medications at the right time. Over the course of 3 months, we tried several mobile applications, including those for the desktops. We found early on desktops were not useful, as the device does not alert at the time when the meds are required. When he tried the mobile apps, the main issue was the amount of manual effort to enter in medication details, dosage, and frequency. Now, for someone who's very slow with thumb typing and also impatient, these mobile apps were not easy to use. If setting up one med took 5 to 10 minutes, setting up in my dad's case 5 meds was going to be very cumbersome. We had to remove the manual effort. Then there was the old pillbox solution that my father was using. This was working great to assist with organizing the pills to take on a daily basis. However, they were not reminding him to adhere to any specific regime, and there were no tools to reinforce management of the medications and help him organize the meds automatically. For example, pillbox doesn't remind us when to take and how many each time. Furthermore, my father has to take a combination of puffers and liquid medicines, so the pillbox was not an optimal solution. He had to find a better solution. Going briefly on the statistics, in Australia I found that my father was not the only one with this issue. A literature review indicates strong correlation between the number of people taking medications and the risk of non-compliance. And in 2009, Australians were taking 3.4 medications daily. However, towards 2013, we're looking at 4.4 medications daily. This indicated to me, specifically in Australia, a growing medication adherence problem. This problem gave me the solution of a personal medication management mobile app available for the iOS, Android and Windows phone. It was going to be different because it was going to put the consumer at the center and the ability to access information from the PCEHR, integrate data from the NPDR, and also liaison with the pharmacists. It was going to be a hybrid application and empower the consumer to take control of their medications and improve medication adherence rates. The Medication Manager mobile app connects to the necessary data sources, such as the NPDR, or the National Prescribing Data Repository, which holds the prescription and dispensing information, and the PCEHR, to extract patient prescription information for medication name, dosage, frequency, and the available repeats. The mobile app will store the medication information in a standards compliant format so it can be integrated and synced together with their PCEHR. This removes the need for consumers to manually create the prescription data on their mobile phones, allowing our system to automatically set up alerts, reminders, and list the medications the patient needs to take. For pharmacists and doctors that are still transitioning to the PCEHR and NPDR service, there is a win-win situation. Pharmacists and doctors can provide prescriptions with QR codes and barcodes on medications. Our mobile app will then be able to scan that information, and the medication data will automatically populate onto the device. For the information to be active, the patient will be requested to set up their PCEHR account, allowing the medication data in our mobile app to sync with their online record. Our reminder functionality notifies users even when the phone has been turned off or when it is on silent. It does this by leveraging the native notification features in the device. For example, when there is a medication reminder in the evening, our mobile app will use the device LED lights to indicate a medication is due to be taken. This will help users, especially at night time, remind them to take and inform them that their medications are due. In addition, when the user checks the notification, individualized reminder alerts will advise the user about the medication adherence. I will outline more on this later in the presentation. Tapping the alert brings up additional actions you want to apply. Swiping the notification will dismiss the item for a short period before it appears again to remind action needs to be taken. Our mobile app will have the functionality to remind a family member and record consistent non-adherence if a med has been dismissed more than 3 times. We've made the functionality easy to use, reducing the amount of effort for the user to manage data. Instead, our mobile app will push the right medication information to the user at the right time. So the options available when the user taps any of the alerts includes acknowledge to indicate the meds have been taken, delay to set a new time to remind when to take the medication, and not available. So for example, if the meds are finished or lost, or just by accident the user has missed their dosage. For the more advanced users who want to take control of their medication schedule, users can get a bird's eye view of all the medications for the week, all the way up to a daily schedule for each hour. Sometimes the med is inconvenient to take at a certain time because we may be away from the dinner table or stuck doing odd errands. This schedule can be integrated into the native device calendars so we can be reminded together with all our other schedules. Note, in our mobile app, we extract data from medication databases to display the medication image, the medication details of the item, and any special instructions. This information can be extracted from the NPDR service. To reduce intentional non-adherence caused by concerns about dependence or believing the medication to be ineffective and communication problems such as side effects, instructions to take the meds and special instructions, our mobile app will push med information to the user when persistent non-adherence is identified. For example, if my father continually forgets to take his meds and our system notices a regular pattern when exercising, the mobile app can push information to remind that stopping medication is not recommended, and then provide additional education material to support that. Our mobile app can also assist with non-adherence to medications by tracking compliance at the home address and non-adherence when the patient is away from home. Certain patterns of medication behavior can indicate the patient has forgotten to bring the medication or has just run out. Our mobile app can then push out a reminder and provide assistance where the nearest pharmacy location is to purchase their medications. This will leverage off the database of registered pharmacies and the GPS location system on the mobile device. Worried about your family? Use our mobile app to invite additional family members and to assist with their medication adherence. This will help drive the adoption of the PCEHR record, as each new family member who wants to use the medication manager needs to have an active PCEHR record to sync and integrate their medication information. Adoption will be fast because it has been designed with minimal interaction required for data entry, preventing errors in medication details, and easy for children at school and elderly alone at home to use. The mobile app will be tightly integrated with the native phone functionality to quickly call in case there has been consistent non-adherence during the whole day. The benefits to pharmacists and doctors is obvious. Integrated medication reminders helps keep the medication regime simple to manage. Also, a consolidated record for medication history and compliance provides valuable information to improve the patient outcomes and their treatment. Our consumer benefit includes one of our unique selling points, which will be leveraging our underlying algorithm that will drive the medication manager reminders. Rather than plain vanilla alerts reminding the user to take their medications, we will track the patient's patterns and medication usage to determine the best alert to display. For example, regular forgetfulness or patterns of behavior will determine the type of message and alert we can send out to the patient. Also, since most of the details will be synced up with the PCEHR and NPDR service, the user has only to tap and acknowledge meds that have been completed. And managing multiple family members will help give the caregiver in the house more ability to improve adherence and assist with medication information to overcome communication barriers. The national benefits include adherence to medications, decreasing healthcare costs, increasing the adoption of the PCEHR records, and data can be used for evidence-based research for medication compliance. The delivery model will be through adding family members to the Medication Manager mobile app, word of mouth, pharmacy education, and patients will be able to download the app through the Apple Store or Google Play Store. I hope you have enjoyed my presentation on the mobile app Medication Manager. Feel free to contact me on LinkedIn or Twitter, where I have several feeds on mobile technology and the healthcare area. Thank you.